Hafade, buenas. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Monday, April 3rd, 2023. And the time is 8:39 a.m. In compliance with the open government law, public notices for this confirmation hearing were published in the Guam Daily Post and the Government of Guam Notice Portal on Monday, March 27th, and again on Friday, March 31st, and live streamed on the Guam Legislature, and this hearing is live streamed on the Guam Legislature's YouTube channel. Public notices were also sent by email to all senators and all main media broadcasting outlets on those same days. So for this confirmation hearing, individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. We will hear from those here to provide testimony, and then we will allow for questions or comments from the senators panel. We have only one agenda item for this 8:30 confirmation hearing, and that is the confirmation of Ms. Antoinette Kleiner as a member to the GMHA Board of Trustees for a term of 6 years, from July 11, 2019 to July 10, 2025, to fill the unexpired term of Evangeline Allen. Ms. Kleiner was appointed by ANTAGONISTS on February 15, 2023, and referred to the Legislature's Committee on Health, Land, Justice, and Culture on February 23, 2023. So the Guam Memorial Hospital Board of Trustees mandates in 80105.1 of Title 10 Guam Code Annotated requires that the board shall be liable for the negligent act of any hospital employee or officer if the board knew or had noticed that said employee or officer was inefficient and incompetent to perform the services for which he was hired, or said board retained such inefficient or incompetent person after knowledge of notice of such inefficiency or incompetency. It also requires that the board shall be liable as fiduciaries in the execution of their duties, and that no trustee shall be actively engaged in the selling of services or goods to the hospital without the express approval of the Board of Trustees. The form of approval shall be by the adoption of a board resolution confirming said approval. The restriction shall not apply to healthcare professionals who provide direct patient care services to the hospital, and that no trustee shall act when a conflict of interest occurs. All right, so before we proceed any further and hearing from those here to testify, I'd like to recognize the presence of my colleagues, Senator Telo Taitague, Senator Jesse Lujan, and Senator Chris Joines. Good morning, colleagues. Thank you for being here. All right, so we're going to begin with testimony from the nominee herself, Ms. Antoinette Kleiner. Is there anyone else here to testify? All right, please proceed, Ms. Kleiner. Oh, press that button first, yeah.
Press the button.
There you go.
Will it stay on or? Okay. Happy day. Good morning. My name is Mrs. Antoinette Kleiner, and I am honored to have been selected for this appointment and hope for your review to be positive. I am a daughter of Guam, and I was born and raised on the mainland. My dad is a proud veteran for the service, and the reason I applied for this position was with the intention to return home with the wealth of experience and knowledge that I bring from my 25 years as a nurse, working with many underserved and underprivileged populations on how to help improve the health of our island and our island people. My real passion is to make sure that those who are taking care of our patients, our people, are well-trained and are highly competent to serve that duty. As such, I returned to Guam in 2021 to fulfill a position as a nurse faculty at the University of Guam's Bachelor's of Science in Nursing program, and I have happily graduated now one class so far, and the second class will be graduating this May. My intention as a nurse was always to serve My parents instilled that service in me, and my 20 years, nearly 20 years of working with the Indian Health Service gave me a true understanding of the meaning and the importance of community service and working with communities to help them bridge those gaps with the agencies and funders to help allow them to reach their full potential. So in that vein, I really want to be able to help the Board of Trustees navigate these modern times so that we can improve the health of our people. Thank you.
Thank you very much. Can you just clarify for me? So I see you have a master's in nursing.
Yes, ma'am.
Is that a nurse practitioner?
I have dual masters. I have a master's in the science of nursing in health education, as well as a master's of science in nursing for family nurse practitioner. And I would love to be able to serve as a nurse practitioner. However, my duties as a nurse faculty have been such that I've not been able to fulfill the use of that license, except for community service. So I use that doing volunteer work.
Well, thank you. I think we've been calling the nurse practitioners doctors in here, so my apologies, Dr. Kleiner. Thank you for your willingness to serve in this capacity and for coming back home. I'm very grateful. It's my understanding that your nomination to this position was also encouraged by Dr. Hattori Uchima, our good friend.
Yes.
And so I'm very confident, and I've heard great things about you from other faculty as well, and that and your resume is really stellar. The experience that you bring to Guam from the different places that you've been employed, the Navajo Medical Center, San Juan Health Partners, Pediatrics, the Indian Health Service, the Johns Hopkins University, and other places. I think Scripps is also in here.
Yes, ma'am.
Yes. Thank you again for being willing to serve in this capacity. So, as a GMH board member, as I read earlier, you're going to be required to, serve in a different capacity, and this is pretty much it's fiduciary. You're liable pretty much for what they do there if you know that they are not doing something or doing something in negligence or intentionally to, that's going to hurt people. So we've had some issues with GMH, as you know, and we want to make sure that we have board members that are going to be very responsible and not kind of wash their hands. That's not, and we really want them to know what's going on there. We want them to speak up, to be involved. We had some board members who were never aware of what the budget really was because they just went along with management who would tell them what's going on, and then they accepted that. But I would like to see board members who are going to question everything because you are responsible for that. And so when we have these issues, such as a contract for collections that was, in my view, not necessary earlier because they were doing a good job with collections and they were working very closely with the Attorney General's office, and then they entered into this contract, and then the legality of it was questioned, and then it ended up being terminated. And then we ended up in another situation with this breach of the data systems, I guess, and which caused patient care to be, I'm not going to say jeopardized, but definitely, became harder for them up there. They had to switch to manual systems, and apparently they were not all the way prepared for that they had not had these plans in place prior to these things. So, of course, you're not on this board yet, and so you're not responsible for any of those, but I just want to know from you in general, like how do you intend to take your position on this board? How active do you intend to be, and are you going to be able to do that with your position at the University of Guam?
So that's a great question. As you know, having known Dr. Hattori Uchima, I've been very involved in many things in addition to my faculty duties, so we do a lot of community outreach. I see this position as an extension of that and a responsibility to the community. So my plan is to be as involved as I need to be to understand the details of what's laid in front of me so that I can make an objective decision. As a nurse, that's how I'm trained, look at the data and move forward from that, using that data. I also see this as, because it is a fairly large responsibility that I'm undertaking here, should I be approved, that I will need to scale back on some other things. So I need to have been working on ways to be more efficient in my other duties so that I have more time to perform this duty as well as still have time for my family.
Thank you, Doctor. Your nursing background and as an instructor, so one of the big things, I think, the challenges that the Guam Memorial Hospital faces and all of Guam faces is, a shortage of nurses. And but the University of Guam is really instrumental in meeting this need and really advising on how best to meet this need, right? So Dr. Uchima was a very big advocate of and partner with GMH. They partnered in training, and GMH, she was always praising GMH and GRMC for allowing their nurses to come in and be trained at a very high caliber, with very high caliber nurses alongside of them. And of course, we've been trying to up the scholarships available for these nurses so that they can get into these programs earlier and be supported all the way through. But really, I think that's the limit of GMH, right? We can't expand without expanding our nursing capacity. And so I'm also looking forward to your partnership in that and your advice to everyone on both sides of how we're going to get there, is because that is such a great limit. Did you have any comments on that?
I love UOG. I am really in love with the program there. I don't know that I would have made the same decision to return home at the time that I did if it hadn't been to come to this job. They are a very high caliber school, and I'm very impressed with the dedication of the faculty there towards creating a great nursing service, and I'm very proud of the nursing students that I've gotten to work with. I think that we just need to continue to find creative ways that we can expand our reach with our nursing students and allow them to really understand the importance of working here. I am a military brat and I love to move. I think that the exposure to different places and different situations, different types of systems is helpful, but I also want to be that role model for my nursing students that it's important to also serve at home. So go spend a couple years, but come home.
I appreciate that. And I appreciate you bringing again your experience to GMH, and I think serving high-risk populations, indigenous populations that are, again, coincidentally at high risk, that we are going to see benefit from your being in this position. So, Sidzus Masi. I'd like to recognize the presence of some of my other colleagues, Senator Chris Barnett, who also is here. And I'd like to open up the panel now to Senator Jessie Lujan.
Thank you very much, Madam Speaker. Good morning.
Good morning.
How are you doing this morning?
I'm doing fine, thank you.
Good. The speaker spoke about, of course, the uniqueness of the challenges of the Guam Memorial Hospital, and I look at, of course, your diverse background, and there's no doubt that, in my mind, that the diverse communities that you worked at, you'll bring that expertise and the uniqueness in those communities that you worked at here to Guam as well, and I'm sure those different communities that worked at as well had their unique challenges, and so we have our own unique challenges as well. So I congratulate you on wanting to step up, and again, one of Guam's own wanting to come back. So congratulations on that. Where do you see GMH in I know you're new coming back to Guam, but where do you see GMH in the short term and in the long term, 5, 10 years maybe from now?
Thank you, Senator, for that question. My short-term dreams for GMH is that we can weather the current difficulties that we have going on, right? I have been paying attention to the news. I know that there's different issues that we're several issues that we're facing. My goal and dream there is that we can weather through that and find the best solution for the people of Guam, and that we find the resources that we need in order to make those solutions happen. My experience with the Indian Health Service has taught me that you can do a whole lot with, unfortunately, meager resources. We need to be creative about that. So I'm hoping that we can find those solutions to those short-term. The long-term dream that I have really started from the time I came back in 1988 and visited GMH when my grandmother was there. And unfortunately, that hospital has not changed much. There's some improvements, I will have to give credit to that, but that hospital needs significant change just in the environment of care there. And so my long-term dream is that we are able to provide a modern space, wherever that, once those decisions have been made, we need a modern space where our patients deserve that higher, more modern space to take care of them. Our nursing staff and physicians and ancillary services deserve a better environment to be working and serving their people in. So that's my long-term dream.
As an instructor up at University of Guam, you said you just graduated your first class. Congratulations! How many students?
The class of 2022 had 32 students. They 32. Were my rookie year.
Oh, great! That's fantastic. What is when you look at that? And I know, one of the challenges you're saying is to be able to keep those nurses here on Guam.
Right.
What is the biggest challenge? Of course, they'll be pilfered because of pay and things of that nature, maybe a better working environment, not as much political interference and all that. But what do you see as a challenge of keeping those students here and lessening the need for the traveling nurses?
So I think one of the challenges that the nursing students have shared with me is this dream that there's something better out there. And unfortunately, in my experience, you have to explore that oftentimes for yourself and learn maybe the hard way that it might have been pretty, but it wasn't necessarily better. It is part of your journey, though. I've made those missteps along my own path, and they lead you to where you ultimately are supposed to be. So one of the things that I've been able to do with my nursing students is work with them on community sensibilities and mission to instill that passion there with them. And that's the way that I've been able to try to solve that problem, encouraging them to get their experience here. GMH offers them an experience that allows them to go anywhere, I tell them. The skills you're going to learn because of our partnership with GMH, you're going to be able to walk into any field clinic anywhere, whether you decide to go to the mainland or you're in the third world nations, because of what you're able to learn here. Our partners at GRMC, we get to have a different type of experience for them, and many of our students have been employed there as well. I think in the class of 2022, if I remember correctly, I think we're fairly equally split. Our graduates have gone to GMH and GRMC. They talk about this kind of allure of traveling somewhere, and they talk about the challenges of having burnout from feeling overworked in the spaces they choose to get hired on here. As long as
the departure entails a road that returns back to home.
Yes, a road that returns home.
As you did yourself. But again, I have no qualms in your qualifications. I look forward to voting for your nomination. And again, we have some hospital that you used to work at had a rhinoseptoplasty 47 years ago, and it's still holding up. It's still holding up, so it can't be that bad.
It was a good hospital then. It's still a good hospital now.
Yeah,
Yes.
Alvarado Community Hospital, right,
Yes.
in San Diego. Yeah,
Yep.
but again, congratulations on the nomination. I look forward to voting for your nomination for the Board of Trustees.
Thank you, Senator.
Thank you, Senator. I just want to recognize that we have present with us today Dr. Dustin Prinz, who's also from the GMH. I think you're acting medical director? No, acting CEO. Acting CEO. Okay. Thank you for being here today. We also have Yuka Hechanova, who is, I think, the CFO of GMH, the Chief Financial Officer. Thank you for being here. And Dr. Catherine Wood from our beloved University of Guam Nursing Program. Thank you, Dr. Wood. And I know Attorney Luther's here from GMH, and I'd like to recognize all of you. We have the Blases are here, Antonio and Bernadita Blas, and the rest I don't have on the list, but thank you also for being here as well. I'd like to recognize now Senator Chris Duenas.
Situs Masi, Madam Chair, and to Antoinette, I don't want to mess this up, Kleiner, is that correct?
Kleiner, yes, sir.
Welcome.
Thank you.
You know, it's so refreshing to see someone, a homegrown daughter of Guam, and also someone who is returning to Guam during a time when many people are leaving Guam, unfortunately. And so I want to commend you and thank you, first and foremost, for obviously your love and appreciation for your homeland, and particularly for medical care, particularly nursing care. I have to say so far, it has not only a refreshing, but a very important nomination. And I just have 3 poignant questions that I want to put to you. Our speaker mentioned it a little bit. I want to go in a little bit more depth. You know, recently the incident with the cyber attack brought about, I think, 2 things. One is, of course, the need to harden a system. You know, many organizations, you know, have seen that as vital, and I'm sure that's underway. But my concern in some of the things that I was able to read and hear about was there were loud voices that I think weren't being heard to a level of what they felt in terms of their operational capacity and service care delivery and their vital delivery of medical attention to their patients. And my direct question to you is, not just surrounding this incident, but because of what this incident has put forward, do you see yourself as not only an advocate, but a champion for communications and also making sure that particularly those frontline people, the nurses, people who are living with the decisions on a real-time basis, 24/7, do you see yourself not just as you're going to go forensically through this incident, I'm sure in what military and federal programs call the hot wash, which is basically the after-incident get-together. I just wanted to ask you that question directly.
Thank you for that question. And yes, I've gotten actually a chance to see how the nurses on the front line, as you called it, experience that effects of the breach and how they had to enact their protocols for manual documentation and the challenges that presented. I absolutely see myself as an advocate for nursing care. I believe as a nurse, and no offense to the doctors in the room, but I believe as a nurse that we are that front line, we are that last line to our patients, and that's always been where I see the importance of nurses. So we need to support those nurses so that they can create great environments of care and healing for our patients. And I've been blessed to work with most of the doctors in my career that also agree to that. The challenge has always been trying to make sure that the administration that's, providing those protocols and helping to guide us with those policies, not only hears and understands, but also is resourced with the needs that they have to enact those capacities for the nurses and therefore for the patients.
I wish I could vote now. But, I don't think this can ever be overstated.
Right.
And the reason why is because, as you know firsthand, your ability to provide the services and the critical medical care to your nurses or to your patients is not only just your skills and your experience, it's your state of mind and the condition.
Yep.
And that's why that's so important. And I think you're going to have a refreshing voice within that board, because this board is very powerful and they do a lot of critical work. And that leads me to my second question. My second question is, my good friend and colleague, Senator Lujan, discussed politics. Sometimes there's a miscommunication of politics and policy. Policy sometimes, when the legislature is trying to exercise their duties, is sometimes viewed as politics. But I want to tell you that I can vouch for many in this hall who believe and take our responsibility very seriously and take it at a level, from a policy level. You'll be making policy decisions within this board. And so I just wanted to get from you a feeling and a reassurance that you clearly understand, as being confirmed by this legislature, that there is a duty and responsibility of this body to do their due diligence. And I'm just going to give you two instances. You will, of course, be dealing with a proposal now, as we read in the paper, of fees and costs associated with the hospital. You also will be dealing with issues in the future of compensation, of resolutions that are passed. And my point to this is that in the end, unless there is a more robust funding source, either from outside sources such as the federal government, or there is massive collections and these fees transform into large pots of money, most of that is going to come from appropriations from this legislature of tax dollars. And so my question to you directly is, will you understand when the legislature, through their membership on the board, through their other interactions, say that we need to work together on making these decisions, because that is the only way that we get rid of the politics and deal with policy.
Yes. Thank you. Yes, I absolutely share that sentiment. I don't believe that politics has any place in healthcare. Policies are what help drive us and protect us with the work that we're doing. So my intention is, and has always been, to gather all of the data so that when I make a decision, I can make the most objective decision about that as possible, and then to follow the policies that I'm given, since that is what I am liable for as a nurse.
Once again, I wish I could vote now. So my last question. There is no secret that there is a very, very ambitious project looming that, for the hospital purposes, many, if not all of us in this legislature are in absolute full support and agreement on. On your return to Guam, and you mentioned, unfortunately, you've seen some outgrowth and some wonderful new things. I would think probably it might be the ICU unit that was not recent, but has been upgraded. Telemedicine has made an appearance, although I'm sure probably somewhat interrupted during this cyber issue, and a number of different things. But your observations of not much has changed is true in terms of the structure. This legislature has been concerned, and I'll give you a couple of examples. We have an Agotño pool over here that has been closed probably for over 6 years now, that is would be quite minimalist in the grand scheme of some of the big CIPs we're planning to do. But even a school such as Simon Sanchez is now in its decade of a proposal to have it built. And, currently maybe within this year awarded. I think you know where I'm going. Will you be a strong advocate, as many of us in this hall have been, to repair and renovate whatever we can within that GMH hospital, because we need to sustain it as a hospital that can provide proper care going forward before we even get into the procurement of a new hospital, which many of us are for.
So I see this, both of these goals as running simultaneously. I think that in the short term, we need to continue the hard work that is ongoing right now among the staff at GMH to continue serving their patients in the best way they can. I am so impressed by the nurses and staff that I work with during our clinical rotations on the obstetrics and pediatrics unit. I would put my children's lives in their hands. That's how great I think they are. They do that with the meager resources that they have, and they do that despite the challenges that they are undergoing. So I see the need for renovations or upgrades or whatever that is as something that needs to be considered and, and decided upon objectively so that we can get the most return for what we're putting in. Because as you all are very aware, that building cannot last. That building needs to be, we need a new building. And that, I think, I've been very passionate about for a very long time. But that runs side by side. That discussion needs to also continue, and we need to come up with the solutions so that we get that new building. But in the meantime, we need to continue to reinforce the work that the staff there are already doing.
Man, I want to vote again. So, full disclosure, my favorite nurse, my wife is a critical care nurse in the ICU. So I don't want to, I think it's important to put things on the record. And so that's one of the reasons why I'm such a staunch advocate for what this body has worked for. I agree with you, Antoinette. We're not looking at building a new wing. We're not looking at the latest and the greatest. What we're talking about is roof repair so that it doesn't leak and damage things. An electrical panel, that is critical to the service delivery. Backup generation that's adequate to make sure things happen. And this is the thing that we have been talking about here, Antoinette. So I think that we're on the same page. And boy, I hope we go into session soon, because you certainly have my vote of confidence and will receive my vote on the floor. Sidus Masi, Madam Chair.
Sidus Masi, Senator.
Senator.
Senator Taitague, you are recognized.
Sidus Masi, Madam Chair, and good morning to my colleagues. And good morning, Antoinette.
Good morning, Senator.
This is a very, and my colleagues mentioned, a very critical board. It's been under a lot of scrutiny, and this body, or at least the 36th Guam legislature, has really put the feet to the fire on the board and what they have done and what they haven't done. I think it's our responsibility to ensure that you are the right fit for this position. First, I want to thank you so much for wanting to step up to the plate and serving. I read your letter to the governor stating why you want to be on this board, how you want to contribute back to the island. Greatly appreciate that, first and foremost. And by the way, did you get permission from your family?
Well, he didn't give me permission beforehand, but he's always supported me, and my parents have always supported me.
Well, that's so important because, like I said, this board comes under a lot of fire sometimes, and you're going to need family support, to help you through this, to remind you to do the best you can and be honest and truthful. My concern, always is versus what is right for the people of Guam and taking directions from somebody who has a different, intention. So that being said, I know that the name of Dr. Margaret was brought up, and many of us love her so dearly, and she was one person when it came to integrity and basically saying what's on her mind. She was one that did it. Didn't matter politically. It was what was so important. So I hope you realize, too, that going on this board, whatever you do moving forward, is going to be in question your credibility. So your choices that you make, your credibility is on the line moving forward. So it's so important to make the right decision based on your experience, and God knows you've got great experience when you come to nursing. But you're going to be voting not just on nurse issues or salaries for nurses. You're going to be voting on other things in the hospital that are just as important. And it's important that even though you said you have the data, you look at data and research, I'm hoping you make that effort because you already have that nursing background to understand off the top of your head what is needed. But now we need help when it comes to infrastructure, cybersecurity, salaries, choices being made on how to move things forward for the hospital in the best interest of our people's health. So, have you had the opportunity to read the board minutes in the last 2 years?
I haven't read them recently. I did read them before submitting my application, what I could access through the Board of Trustees website. I was able to read some of the minutes. I can't honestly recall much of what I read at that point, but I do remember that I was able to find and access them.
You find and access them, but you haven't read them yet?
I read them when I applied, and full disclosure, I applied for this position last year.
2022?
2022. I honestly thought somebody forgot about it.
Of what month? Of what month?
Oh, it was in the fall? It was in the fall, I believe.
So pretty recently. So there are minutes of the meeting that go back to the issues of the hospital, like almost decades, of issues. I heard you twice mentioning that you look at the data. Okay, well, that's where the data is at right now.
Yes.
So I highly, highly recommend you read those board minutes for the last at least 4 years. I mean, there's not very much activity, or there was some activity during, I think it was 2020, when they were looking at the salary increases and how the hospital moved toward that. And was it done correctly? Did the board follow the rules and regulations as what guides them as a board? And that's one thing that really needs to be researched on what are your duties and responsibilities as a board. But it doesn't stop you as a woman to speak your mind, because God knows I speak my mind. So I hope that you do stand up to certain things that may seem intimidating, but know if you're on the right track that you have this body supporting you. And that my door is always open. If you see anything that's questionable, that you give me a call. Or the speaker is, who oversees health. I sit on her board as well. So I look forward to hearing from you if you see something off the wall. And by the way, San Diego, what a beautiful, beautiful place. I just came from there last week.
Oh, nice.
And I've never met so many Chamorros. So many Chamorros that are proud to be Chamorro, love this island, and never been to Guam.
Yeah.
But are so anxious to be a part of helping other Chamorros move forward. And I see that in you coming back here to this island. I'm sure you're making a lot of them jealous that you're back here. But again, I appreciate that. The infrastructure was brought up. A lot of questions were brought up earlier. And I don't mean to scold you. I'm just hoping I'm helping you when it comes to taking on this position. You have no background for me to judge on this point, taking your love and word for it. promise that you will let us know if you see something that's not right or questionable.
Absolutely. So as a nurse, my growth has led me to one overarching motto. I always have a patient in front of me. And at this level, my patient would be Guam.
So other than the nurses, what other area, as a board member, are you interested in also looking to improve or to add on other than nursing?
Do you mean as far as on the board itself or in the hospital?
Well, from what I gather, and I was told that board members have certain, committees,
Okay,
right? And I'm sure you're going to be going on anything that has to do with nurses, right?
of course.
But if there was something else that you were to choose, what area?
Patient satisfaction. That would be the...
Excellent. Okay, great. Oh, that's good.
I feel that it's absolutely vital that we hear from the people that we serve on what their experience is in our healthcare systems and how we can better serve them.
And if you have some time, can you please look at grants,
Yes.
opportunities and grants?
We need opportunity. We need the funding. We really just
Absolutely. And to make sure that these grants are spent correctly, that you go after every opportunity that the board has. So who's ever in Guam Memorial who's tasked with grants, you need to stay on their case every single day for funding. Other than that, your credibility is now on the line here. So
Understood.
I wish you the very best, and please take my offer that my door is always open if I could be of any help. Okay? Good luck to you. Thank you, Madam Chair.
Thank you, Senator Taitague. Senator Barnett, you're recognized.
Thank you, Madam. Thank you, Madam Chair. Good morning.
Have a day.
I just had a few questions, but you mentioned that you wanted to oversee patient satisfaction.
Yeah.
And so I did have a concern, and I just wanted to get your opinion on this. This is coming from a constituent. They wrote, Senator, when are they going to end the restrictions at Guam Memorial Hospital, the emergency room, or the hospital in general? It's so hard to leave loved ones, seeing them struggle with their pain, and yet they'll still need to fill out the papers, provide documents, but when you have someone with you, like a family member, other half, someone who could help assist while you're at the ER. I thought they ended the public health emergency, yet they still practice or do the COVID restriction rules. I hope things can go back to normal, where we can follow them into the emergency room. Just, I guess, what's your opinion on that? Because I know I am getting a lot of concerns about that.
I hear a lot of concerns about that amongst family members and other people that I speak with, patients and their visitors, when I'm there at the hospital for clinical rotations with my nursing students. It is absolutely an issue, and it is an experience that we need to improve. We need to, so my opinion on that is that we need to continue making sure that we're following the best practices for the hospital and that we're communicating that in such a way that patient families understand whether, if they don't agree with what the decision is, as in the case that you just mentioned, that we do a better job of helping people understand why those decisions are being made. Right? I would not venture to say that I'm the expert right now on what that visitation policy should look like. I would need to do my research and make sure that I've got the best information to offer and then to guide with. However, I think it's really important that we communicate to the people we're serving why those decisions are being made so they can understand the process.
Thank you for that, ma'am. Coming from San Diego, right?
Well, I came here from New Mexico,
Okay.
But San Diego was my father's last post, and so I met my husband. We raised our children in San Diego before moving them to the Indian Health Reservation in New Mexico.
So, to the best of your knowledge, are most of the healthcare facilities in the state still following a lot of the COVID-19 protocols?
The Indian Health Service colleagues that I have still in contact are still following quite a lot of those visitation rules, yes.
Thank you, ma'am. Could you just maybe in general terms or a nutshell explain what you believe the relationship between the Guam Memorial Hospital Board of Trustees and GMH management should be?
My view of the two bodies is that they should be working in tandem to improve conditions for patient care. in a nutshell. I believe that they are two teams that need to be working together for the improvement of the patient experience.
Are you willing to exercise any oversight over the Guam Memorial Hospital management if a situation arises where you feel you would need to?
If that's the role that I am given, then yes.
And I also wanted to ask, because I'm sure you're aware, you kind of mentioned all the things in the news about a proposed new hospital complex, et cetera, et cetera. But just what is your train of thought relative to what we do with the existing facility while we wait to build the new hospital? Because, I mean, you know, some estimates say it could be 10 years, 5 to 10 years before we build that new facility, right? And as you said, we need a new building, and the existing facility is on its last leg. So just what are your thoughts on that, and how would you put those thoughts into action?
So my experience most recently has been working in maternal child health area and pediatrics. And so from that example, I think that the things that those staff members need to function, you know, and continue to function are things like Senator Duenas mentioned. There are places where there's drips coming down from the ceiling, and, you know, there's ventilation issues. Those things have to be worked to the best of our ability so that we get the best return on that investment. We can't make a new wing to solve these problems like he mentioned, but we need to do the things that we can do so that it's a safe environment for patients to recover in.
Do you feel that we've overlooked some of the needs of the current facility and our fixation on getting the new one built?
No, I see a lot of people hard at work trying to keep going with what they have and do the best that they can to overcome the issues that they have.
Thank you, ma'am. Just last question, because I know you're coming also from the University of Guam nursing program, right?
Yes, sir.
And I just hear a lot from doctors about our ability to meet the nursing demands and the foreseen, or the staffing shortages with nurses that they're foreseeing. So are there ways that the Guam Memorial Hospital can work in tandem with the University of Guam relative to increasing the number of nurses that we have attending the program? Is that feasible or realistic?
I think that the solution that, I don't know how feasible it is, but the solution that I think would be beneficial would be to find ways that we can have more master's prepared nurses on Guam, especially from GMH and our partner hospital with GRMC. The more master's prepared nurses we have, the better we can support the nursing faculty, because as you know, we're short-staffed, and even more so since the loss of Dr. Margaret. So that's been ongoing. If we can find ways to increase our faculty numbers, we could find ways to increase our student load. We cannot do that at the capacity of faculty we have now.
Thank you, ma'am, and good luck. God bless
Thank
you.
Thank you, Senator Barnett. Senator Fisher, any questions?
Yes, thank you, ma'am. You have a very impressive resume.
Thank you, sir.
Yeah, and I was curious, particularly with all your experience in the Indian nations and with the Indian Health Service. On Guam, my impression is we have some serious health issues that we deal with, issues of addiction, substances in general, nutrition, diabetes, high blood pressure. I'm sure the list goes on to all sorts of diseases and phenomena that are related to poverty.
Yes.
And, well, you see where I'm going. The population that you served in the Indian nations, did they have similar healthcare problems?
Absolutely similar. Everything that we have on our lists for disproportionate rates of disease and increased rates of poverty is exactly what is in existence on the reservation that I worked with. And from what I know of the other reservations, that's the same reality that they're dealing with. So the impressive thing that I was able to learn from them, not just in terms of fiscal management, was the need to work with those federal partners to gain every penny that they can for funding the services that they have, and then going after grants. There's a whole sector on community work and grants, and that's how that's funded, so that we can have the resources to serve and to meet the challenges of all of those disproportionate diseases.
Along with grants and the fiscal issues and so forth, have you learned anything? Did you learn anything in your experience, in your life experience, that we can use here on Guam to help with our issues of addiction and et cetera and so forth?
So some of the things that I learned there was the importance of having robust community programs. So as I mentioned, they had a whole sector that was community health programs, and in that umbrella were a variety of departments that went out to the community and were stationed at, for instance, the chapter house to provide education, to screen patients, to bring training to the staff working in those very remote places on the reservation, so that they had access to the most up-to-date resources and knowledge, right? One of the other things that I learned there was the importance of making sure that we were able to manage to get our patients on insurance. I think we have a similar problem here. We have a lot of patients who qualify for Medicaid, Medicare, and do not get on that insurance. The example that we had at Navajo Nation, where I worked, was they partnered with the Medicaid offices and gave them a space in the hospital, so they were right there to go apply the patient and walk them through the Medicaid application, help them go through the process so that they could remain on Medicaid. And the hospital benefited from that because now they could bill Medicaid and be reimbursed for services. So.
Okay. In your prior work experience in the Indian nations, did you see, well, we have a huge problem with diabetes here.
Yes.
Huge. Did that also exist in the Navajo Nation?
Yes. There was a whole department on that, too.
Oh, gosh. Do you have any suggestions? I mean, I know that question is about as broad as it's possible to get, but what can we do? What can we do to bring that into check?
So there's a lot of things that we can do. Some of these, I am admittedly newer to Guam, so I don't know all of the programs and resources that we already have working hard on this problem in particular. But for diabetes especially, it's a multi-pronged intervention. You start with things like teaching the children, right? So health education and PE at the elementary level. You continue with going out to teen outreaches and placing clinicians in the high school so that they can talk with them and work them up for potential diabetes. Because I saw children as young as 6 years old diagnosed with adult onset type 2 diabetes on the Navajo Nation. It's very prevalent there. You continue that with robust programs on management and case management of diabetes, making sure that you're working with not just federal and insurance reimbursement, but also with the pharmaceutical companies themselves to bring technologies and strategies to the point of care. So for instance, my colleagues in the diabetes department wrote grants to bring glucometer sensors that patients can wear, as opposed to checking their blood sugars by finger sticks. And then we were able to provide that service, that supply, and that follow-up so that you could hopefully help patients find a better choice. Because it boils down to patients choosing that care and choosing that education and choosing that lifestyle to be able to make some of those changes. So I think there's a lot of strategies that can work. I think it takes all of them, quite honestly.
I agree with you. I think education's a large component of this, and there's more than that. I mean, the poor and the working poor, their access to nutrition is often poor, not by choice, but by economic circumstance. I hope, ma'am, that when you are on the Board of Trustees, that you will be and continue to be an advocate for the poor and the working poor and all of us here on Guam. I believe that healthcare is a human right. And I want to see everyone have access to adequate health care. Thank you very much. I think you're an excellent candidate. I wish you well.
Thank you, Senator.
Thank you, Senator Fisher. There being no additional individuals to present further testimony, then the committee will consider the appointment of Dr. Antoinette M. Kleiner to the GMHA Board of Trustees duly heard. Thank you, ma'am.
Thank you.
Sujus Masi. This public hearing is now adjourned. The time is 9:35 Chamorro Standard Time. Off a day. Thank you. The Committee on Health, Land, Justice, and Culture is now called to order. Today is Monday, April 3rd, 2023. The time is 9:37 Chamorro Standard Time. In compliance with the open government law, notices for this public hearing were published in the Guam Daily Post and on the Government of Guam public notice website on Monday, March 27th, 2023 for a 5-day notice, and Friday, March 31st, 2023 for the 48-hour notice. It's being live streamed on the Guam Legislature's YouTube channel. Notices were also disseminated via email to all senators and all main media broadcasting outlets on those same dates. General rules of conduct: individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. Agenda items that will be heard today are the following. Bill number 73-37LS, sponsored by Speaker Therese, Senator Chris Barnett, Senator Telo Taitague, Senator Joanne Brown, an act relative to further expanding access to opioid antagonists by establishing an emergency opioid access bystander program and allowing insurance companies to cover the cost by adding a new subsection 16116 and subsection 16117 and 16118 to Title 10 Guam Code Annotated Chapter 16 Division 1, which was introduced on March 3rd, 2023 and referred to the Committee on Health, Land, Justice, and Culture on March 7th, 2023. I'd like to thank my colleagues for attending this morning's hearing, to include Senator Chris Duenas, Senator Tom Fisher, and Senator Telo Taitague. Before we hear from those who have signed up to provide testimony on the bill as one of the sponsors, I'll first introduce the bill on behalf of the Speaker. Bill number 73-37LS, introduced by Speaker Terlaje and co-sponsored by myself, Senator Chris Barnett, Senator Telo Taitague, and Committee Vice Chair Senator Brown, an expansion of the Opioid Prevention Act of 2023, which is now known as Public Law 37-2. These and efforts by the National Opioid Advisory Council, Guam Police Department, Customs, Homeland Security, and the FDA to combat overdose. This measure is in line with those. This measure is also to expand Public Law 37-2 to include a bystander program that empowers the Guam Behavioral Health and Wellness Center to be able to identify key locations to have opioid antagonists so that the public is made aware. Furthermore, the legislation will co-prescribe an emergency opioid antagonist with their prescription opioid and have insurance companies to allow for full or partial coverage of opioid antagonists. The committee notes that the language used for this legislation is the same as the language used in the model legislation by the Legislative Analysis and Public Policy Association, or LAPA. Adding these sections into the law will close the gap for the people of Guam who were not included the first time when the law was first introduced, and further giving access to opioid antagonists. For the record, in addition to stakeholders, invitations to provide feedback were sent to the following: the Attorney General of Guam, Guam Behavioral Health and Wellness Center, Guam Board of Medical Examiners, the Emergency Medical Services Commission, the Guam Medical Society, the Guam Medical Association, DPHSS, the Guam Memorial Hospital Authority, Guam Police Department, the Guam Pharmacists Association, the Guam Board of Examiners for Pharmacy, Health Professional Licensing Office, Calvo Select Care, and Moylan's Insurance. We will now accept testimony from those on the panel. So if there's anybody who's here to provide oral testimony, please come up to the table. Thank you. Yes. Yes, ma'am. Okay, thank you. And just, I'll try and go in the order of the sign-in sheet. Is Reina R. Sanchez testifying? Okay, ma'am. So we'll start with you. So if you don't mind, ma'am, could you please state your name and title for the record, and then proceed with your testimony. And colleagues, I think we'll go the round and then open it up for questions. So Ms. Sanchez, good morning.
Good morning, Senators. I am here to read the testimony of our director, our Guam Behavioral Health Director, Therese, and also answer any questions. Okay, also answer any questions you might have on our involvement with this particular bill. If I may proceed? Okay. Buenas and half a day, Speaker Terlaje and committee members. The Guam Behavioral Health and Wellness Center respectfully submits testimony that provides recommendations on Bill 73-37 LS. Guam Behavioral Health believes that Bill 73-37 follows a nationwide trend that allows for more access to opioid antagonists through co-prescriptions, insurance coverage, prohibition of discrimination by life insurance companies, and an emergency opioid access bystander program. The recent approval of Narcan, a naloxone hydrochloride nasal spray for over-the-counter non-prescription use by the U.S. Food and Drug Administration, will also assist in this matter in time. The only barrier would be that many of those who would need the antagonist may not be able to pay for it. In subsection 16.118 of the bill, Guam Behavioral Health is given the mandate to establish the Emergency Opioid Access Bystander Program. This program is similar to several nationwide options that give free and widespread access of antagonists. Without the bill providing direct funding to meet this mandate, Guam Behavioral Health sees the challenge of non-compliance should funding from the federal government or private entities not be obtained. Guam Behavioral Health is not opposed to standing up the Emergency Opioid Access Bystander Program. However, we ask that Guam Behavioral Health be indemnified should we be unable to obtain federal or private entity funding. Guam Behavioral Health appreciates the opportunity to provide testimony on Bill 73-37 and looks forward to working towards expanding services to the community. Undang includes Nancy Maasi from Therese Ariola, Director, Guam Behavioral Health.
Thank you, ma'am. Christina Perez? Okay. Krista Blankenship? Please proceed, ma'am, and identify yourself for the record. Thank you.
Yes. I'm Krista Blankenship. My name is Joanne Mercado. We are members of the Guam Pharmacists Association, and we are pharmacists. We are in support of this. We feel that the public will need assistance in paying for naloxone. Currently, the retail value, if someone was to pay for naloxone, would be $69 for 2 syringes that... 2 sprays. I beg your pardon, 2 inhaled sprays for naloxone. This is quite an expense for someone that would need to use this product. Pharmacy, if we are to bill this to insurance, we will need assistance with dispensing fees, and that would include counseling and education services. Naloxone is not without danger, okay? This is not completely safe. If someone were to have this product in their home and they had small children, let's say the 5-year-old was to get a hold of this and accidentally give it to the 2-year-old, the 2-year-old could have breathing trouble, loss of consciousness, nervousness, seizures, and weakness. So the pharmacist is going to bear the difficulty of having to train the patient on this product because it's going to be important, okay? So with this, if the insurance companies do pay for this, we will need to be paid a dispensing fee, which will include counseling and education services. And also, since Bill 73 has been passed, 10-73, I have not seen any prescriptions come through for opioids that have had naloxone attached to them. So there needs to be education to the prescribers that naloxone is supposed to be prescribed with the opioid prescriptions, because there has been no naloxone prescriptions with opioids thus far. And also, I think it is important that the fire departments do have naloxone available, but I don't think that there has been any education to the public that this product is already available to them. So maybe we need to get the education out there that the public does have availability of this product already.
I'm sorry, ma'am. Is your testimony relative to Bill 10 or Bill 73?
Yeah.
Because Bill 73 is the one we're currently hearing, and this bill is the bill that will co-prescribe an emergency opioid antagonist with the prescription opioid. So that was not part of Bill 10, so that is actually not law. Yeah, so that is what Bill 73 does. Yeah, I'm just confused because your testimony says Bill 10, 37, but this is already law.
We apologize, yes.
No problem. I'm just, so if you could clarify?
Okay. So basically, what we know is that Bill 7337 is the bystander, passing the bystander. So I think what we were trying to say is that naloxone in March 29, the FDA approved naloxone as an OTC. So that means it can be available, ordered through supplier from the pharmacies. What I know is that I called several pharmacies and they are able to sell naloxone at $69 for 2 inhalers. But the problem is what she mentioned in her testimony is that the barrier is the cost of this.
So what we wanted to ask is, will the bystander program be able to provide some kind of cost relief, like possibly a coupon or something that where the patients will be able to obtain this at that from the pharmacies?
Ma'am, in the bill, the new subsection, we're adding relative to insurance coverage. In general, all Medicaid programs, Medicare programs, health insurance programs shall provide prescription coverage of emergency opioid antagonists and associated devices to all participants. So,
Even for OTC products, I just wanted to clarify that.
I think we'll clarify that
Okay.
coming up. Thank you.
Okay.
Thank you. Ma'am, are you done? Thank you. Thank you so much. Carlos Pangilinan, Public Health and Social Services. Good morning, sir.
Good morning. I'm just here in for my director. Oh, can you hear me? Okay. So I just want to apologize that Director Arts Nagasin's not here today. I just learned that I was actually presenting this morning. In any case, I'm the one that prepared the testimony, so it's fitting that I'm the one that's presenting it to you. Buenas and Hafaday, and thank you for the opportunity to submit testimony on Bill 773-37. The Department of Public Health and Social Services makes and shares the following thoughts and recommendations regarding this particular legislation. Section 16116A, or I guess subsection A, of this bill states all Medicaid programs, Medicare programs, and health insurance programs shall, emphasis added, provide prescription coverage of emergency opioid antagonists and associated devices to participants. We make the following recommendations. Firstly, we recommend delete subsection A or remove reference to Medicaid and Medicare. As long as opioid antagonists and associated devices are deemed medically necessary by a Medicaid participating or an emergency service provider, they would already be covered by under Medicaid. Additionally, our locally funded medically indigent program would also cover opioid antagonists and associated devices in the same manner. Secondly, Medicaid is a mostly federally funded program and service coverage is governed by federal law and regulation. Thus, changes to any types of coverage would ultimately require our state agency, which is DPHSS, to amend our state plan and submit for approval to the Centers for Medicare and Medicaid Services. In particular, 42 CFR 431.10E of the Code of Federal Regulations deems such authority in the state agency. It reads, quote, the agency may not delegate to other than its own officials the authority to supervise the plan or to develop or issue policies, rules, and regulations on program matters. However, well, close first. However, this does not preclude our lawmakers and local stakeholders to offer suggestions and recommendations, which can then proffer as amendments to our state plan for the consideration by CMS. Just to add to that, if you wanted to pursue that route, and not just this, but other types of coverage, you're more than welcome to call me at my office, and I'm happy to discuss it with you. Thirdly, Medicare is a wholly funded and administered by the federal government. Thus, Guam law cannot mandate Medicare service coverage. Lastly, we recommend the word prescription be removed from Section 16116, items A and B. If opioid antagonists and associated devices are intended for use in emergency situations, such language may be perceived as a reason to delay treatment for the patient. Thank you for your time and kind consideration. Should you have any questions or concerns, please contact myself at Division of Public Welfare at 300-7343.
Thank you, Mr. Carlos. And then you can just consider this bill a strong recommendation to the department to pursue amending the state plan. Thank you. Mr. Luther?
My name is Jeremiah Luther. I'm legal counsel
Can you turn on your microphone, sir?
Thank you very much. My name is Jeremiah Luther. I'm legal counsel for Guam Memorial Hospital. I don't have a statement. The director asked me to attend because she was not able to due to a prior health commitment. Oh, sorry. Okay, there we go. I'm here to answer any questions that this committee may have, and I believe that my colleagues have already made any type of insightful commentary that I could make. It would just be repetitive at this point. We agree with the nature of the bill. The language has already been, the language that I looked at that was a bit, from a legal standpoint, a little bit concerning, has already been addressed. I have nothing else to say. I'm here for questions. Thank you.
Thank you, Mr. Luther. Before I defer to the committee members for questions, I just wanted to ask Guam Behavioral Health and Wellness Center, ma'am, if you're able to answer. Why would you need more money to find existing GovGuam offices to distribute Narcan? Is that covered in the grant that deals with distribution to the community?
We currently have some funding that we applied for in 2018. We were able to purchase 200 Narcan, and we provided education and training to individuals that we've distributed to, mainly our clients that are in the MAT program. We have some ready to distribute also to Guam Fire and the police department as soon as they complete mental health awareness training as well as the use of Narcan.
How much funds? How many?
I don't have the exact figure, but we had it in 2018, and we were able to purchase 200. And we'll look for other funding as much as possible to support this endeavor.
Appreciate that, ma'am. I'd like to now first go to Senator Telo Taitague, who is a co-sponsor of this measure. Good morning, Senator Taitague.
Good morning, Mr. Chair, and thank you for the opportunity to ask questions. Since we're on behavioral wellness, just a quick question. Are you working with the Attorney General's office with regards to obtaining any kind of funds needed to purchase these?
Yes, we actually are working on the litigation, the opioid litigation right now.
The judgment that's to be awarded?
Yes.
And you're not sure how much that is? Do you know how much that is?
That one, I'm not sure.
Per district? Okay.
Not sure.
And there's no one here from the Attorney General's office right now, and I think, Mr. Chair, that's really important to have because they are the ones that are really working on any kind of funding that's needed. Going to Department of Public Health and Social Service, Carlos, I thought you were with Guam Memorial Hospital. You're with Public Health?
I've been with GMH for about 5 years, and then I was moved to DPHSS about a year and a half ago.
Okay, so you're there now. Okay.
Yeah.
I started the testimony. I understand, Medicaid, Medicare is all federally funded, and we follow their guideline first, unless it allows us to make any kind of changes to those rules and regulations. Mm-hmm. But MIP, and you incorporated in your testimony, locally funded indigenous program, which also covered opioid antagonists and associated devices in the same manner. I had to beg to differ because MIP is locally funded, and that funding is based on what we say, not what the federal government says. Unless I'm wrong, correct me if I am, please, but isn't MIP based on rules or the funding is followed by us?
Well, what we did when we were asked to review the bill was to look at our procedures and our policies for MIP, and the staff advised me that this is kind of like an emergency type of service. Mm-hmm. Therefore, it would be covered. You are right. MIP is a locally funded, and we follow whatever the rules are in regulation. But for the most part, a lot of the things that we do cover kind of mirrors pretty much what. I mean, there's like
it's easier to make.
There's like broad categories of services, and like outpatient services or emergency services. our staff interpreted this to fall under those types of services that are covered for MIP. So,
I see.
but you are right.
So the guidelines, it's easier to follow the guidelines on federal government, especially using MIP, but unfortunately, and I think, we're on note when it dictates or legislates the funding, how it's to be used for MIP. But I
Yeah.
totally understand on the federal perspective, to follow those.
I mean, if this bill passes, then of course we would comply.
Right, for the MIP section of it. Okay, don't want to do anything against the federal government to lose any kind of federal funding. So thank you for that information. Regarding the pharmacy, that the representatives from the pharmacists, there was a comment that you made earlier that you're receiving prescriptions for opioids, but you're not seeing anything in there that requires that they also get any of these drugs to go along with it. You've not seen any of that. Okay, just wanted to verify.
So I believe what Krista was saying is that we do see patients with high-dose opioids.
Right.
And they usually, what we did say in our testimony is that high dose is about 50 morphine milliequivalents, and then they're also concomitant with benzodiazepines. So since the Opioid Act was passed, we just wanted to know, like, are the doctors aware to prescribe naloxone with those type of high-risk patients?
Okay, yeah, I'm glad you brought that up. That's very good to know data that we're receiving now, so we need to follow up with that. So I greatly appreciate your testimony here today. And Mr. Chair, again, I was hoping the Attorney General would be here this morning to answer any of our questions with regards to the award. But I received a text from, and this has to do with insurance companies, so I'm really surprised there's not a whole lot of insurance companies here today to testify on this, because this would affect them, not only them, but DOA should chime in to see if there's any kind of increase in premiums that it's going to happen because of this. So that being said, Mr. Chair, I did receive a text. Oh, there is the Attorney General speaking, of which, okay. So I'll just, if I can, Mr. Chair, have him sit down.
We can come back to you, Senator Taitague.
Okay, but I just wanted to mention here a text that I received from Calvo's Insurance. And it says, Dear Senator Taitague, I'm away and was hoping to submit testimony within 10 days normally allowed for bills. Our concern with the bill is that it asks insurance companies to pay for emergency opioid, and when the opioid settlement monies were to be used for allergenic and other preventive services as a remedy for the opioid crisis. We will be trying to get a letter to the speaker later today. So that is from Calvo's Insurance, and hopefully get their testimony. And yes, I'd like to go back to the Attorney General, Mr. Chair, once he settles in. Thank you.
Thank you, Senator Taitague. I just had a couple more questions for the pharmacist present. When you prescribe opioids, do you explain the effects of those opioids to the prescribing customers?
I certainly do with every prescription that goes out, especially if they're a new patient. I explain to them the possibility of overdose. I have a sticker on the bottle that talks to them about overdose, and I explain to them the possibility of abuse and addiction. I always have. And so many of them scoff at the potential of addiction. One thing that I worry about, we're discussing these products being covered under insurance. Do we worry about those people that are going to overdose and they don't have insurance? They're buying these drugs on the street. They're not going to have access to the naloxone. That's one reason I said, are we advertising the fire department and letting them know the resource? I think they're at a higher risk of overdosing than the people that are coming in that I'm counseling.
Thank you for that, ma'am. For Guam Behavioral, ma'am, I'm sorry, I don't know if you can answer this, but have you identified locations that may be accessible for the public to go to obtain emergency Narcan and naloxone?
We have not yet done that, but definitely as soon as we identified those, we will be putting out a public campaign.
Thank you. We're going to go ahead and let Attorney General Doug Moylan provide his testimony, and then we'll take it back to the panel for questions. Good morning, Attorney General.
Good morning, Mr. Vice Senator. Senator, we're in general agreement with this. The only thing that kind of stood out was the life insurance. We have to be careful that we don't drive everybody's life insurance up, because they usually use different variables to set rates, right? So the people that are normally law-abiding or, you know, in good conditions, we don't want to mandate that everybody's going to have to pay for some people that should have a higher rate or shouldn't be insured at all on certain circumstances. That was my concern about the life insurance provision. If an expert in the life insurance field can opine, for those of us that would like to get life insurance that's affordable, so we have to be careful about that in that respect. I think for the most part, though, the bill is a worthy bill because it's trying to, I guess, prescribe the antagonist with the opioid type medication to avoid the people that become addicted to the opioids. So in general terms, you know, it's a good feel-good type of legislation. And at this point, we may have one further comment that we can submit later by written testimony. But we're in general support of it, except for the life insurance, that we think it may require an actual life insurance expert to talk to the rates of what it might do to the other people that want it. Thank you.
Attorney General, are you able to use opioid settlement money to create this bystander program to have supplies of toolkits available for public use?
We might be able to. I believe I'll talk with my staff to confirm that. And then we would be open to adding to the bill in that respect. I'll make a note of it.
Thank you, AG. Senator, you're good? Okay, that's Senator Jesse Lujan. Good morning. Senator Duenas.
Morning, Mr. Chairman. No, just look forward to, based on the testimony that's been submitted, looks like the bill would require a markup, and look forward to the committee handling that and you know, putting out the product as concerns have been brought to the forefront. Thank you, Mr. Chairman.
Thank you, Senator Duenas. Senator Fisher, good morning.
Good morning, Mr. Chair. Thank you very much. I am in general agreement with this bill as well. I noticed that the FDA last week has announced that Narcan and other antagonists are going to be available over the counter, probably very, very soon. I hope to see prices drop. But with the idea that it is going to be over the counter, you'll be able to go into the nearest neighborhood village pharmacy and you'll be able to buy Narcan. Does that in any way impact anybody's testimony? Looks like, would you like to add something, ma'am? Or?
I think I pretty much said about the over-the-counter. The only concern that we have is that if they are going to be available over the counter, some of our patients won't be able to afford it. So currently in the pharmacies, over-the-counter medications are not covered under insurance. So that was what I was trying to say was, will the bystander program be able to offer some relief for those patients who do want to buy over-the-counter, possibly a coupon or like some kind of $40 off or something like that. Yeah, but we are, I am aware that several suppliers for pharmacies are able to order it as of today, or actually last week.
Okay.
Yeah.
I think, yeah, that's, I agree, that's generally a good idea, but I would note that a person who cannot afford Narcan probably can't afford health insurance either, exactly. So then we've got that dilemma to deal with. Yeah. There is a very interesting article published in the New Yorker last week. It's about Hays County, Texas, which is a suburb of Austin, and they are currently experiencing a wave of deaths of teenagers from the use of fentanyl. And it has come to the point where it is not uncommon to see stretchers in high school hallways. Children have been found dead on bathroom floors, et cetera, and so forth. As you know, children experiment. That's in their nature. They're risk takers, and many of them are experimenting with and taking risks with what they believe. Often they believe it's something relatively benign, Percocet or something, or Xanax. It turns out that is in fact not Xanax you're taking. It is fentanyl. Children are dying in classrooms. And I would urge everyone to Google it. New Yorker, Texas, opioids. Do you think it would be a good idea? I do. To put Narcan in each and every classroom on Guam. Please.
As long as you teach the teachers how to properly use it, yes.
Yes, okay.
But
Steve Ignacio was here a couple weeks ago, and he showed us how to use it. It's very simple. You know, it's really simple. But I appreciate that. You have to know how to use it.
But naloxone is not the answer to the drug problem.
No, it's not.
I worked on the reservation in Cherokee, Eastern Band. This is not the answer. The answer is getting the drugs off the street first.
Amen.
What you have to do is you have to have random drug tests, and you have to have random drug counts of the people that are being prescribed these drugs.
But as to saving our children's
yeah.
lives, yeah.
That would be an excellent step.
Okay.
But when you test the people and you count the drugs that they have, so you stop the ones that are selling, because we watch them. We fill the prescriptions that the doctors are writing, and then they go out and they sell it.
Okay.
I've been on the reservation, and I've seen the people get shot because they're selling the drugs that you fill for them. I've seen them overdose because they take the drugs that you fill for them. And this is only going to help with the opioids. This doesn't help with the benzos and the others.
Yeah.
It's not until you start doing especially those people that are being, if we've got our public funds paying for these meds that are killing our kids, or whatever insurance, or even if it's cash, until you get the drugs off the street.
Yes,
But we need the naloxone.
Absolutely,
in the
no
schools.
disagreement. Yeah, we got to get it
We
off
need
the
it
street.
everywhere.
Yes. Yes, ma'am, I agree with you. I think everybody on this panel agrees with you. It is not a solution, but it is an emergency. We got to save the kids anyway, right? Okay, I'm going to switch tracks a little bit and go to the Attorney General. Sir, I really wish there was somebody from the insurance industry here. I mean, this is impactful, as they say. If we look at Section 16116 of the proposed bill, it speaks about insurance coverage. We are essentially requiring, we're inserting a requirement for insurance policies prospectively, is my understanding. I think, and so it's two-part. Is there any impairment of contract issue if this is applied presently or retroactively?
Yes, Senator, I believe you are correct, that it probably would qualify as a potential impairment of contract where the insurance companies would argue that the government has increased their cost structures improperly. So it would be at the next open enrollment, or whenever the contract would be renegotiated, that would probably be effective. Yeah.
Would it finesse or avoid the constitutional issue if we were to say, as a condition of receiving a license to sell a contract of insurance, you must agree?
So you make it as a requirement that you must include it. I think it's just the fact that it's Guam law, the insurance commissioner would already have the power, I would think, to sanction the insurance company if they weren't in compliance with it. They'd have to make it part of their policies.
Okay.
So, yeah.
So in other words, to the ABC insurance company, I will not give you a license to write a contract of insurance unless you include this.
Well, I think that the contract would have to take subject to the laws of Guam. I'm kind of like on the side of not putting in too many regulations because I think the effect would be the same. you put it as a statutory requirement, then in any policy they write, they must put it in, or they would be in violation of the law, as opposed to preventing them from getting a license. My understanding of the current insurance companies, they would clearly comply with the Guam law because they're highly regulated.
Do you believe that this section 16116 is, if it passes, is enforceable?
Yes, I believe that this would be enforceable once it, your new contract sort of thing. But as you had pointed out, if it's an existing contract, there would probably be some Organic Act problems with it, constitutional problems with it, to force it immediately.
Okay, and sir, just one more question. 16116 sub A refers to Medicaid, Medicare programs and health insurance programs. Do we have the authority to dictate to whatever that behemoth is in DC that runs Medicare and Medicaid, do we have the authority to dictate to them what prescription coverage they will absorb?
Without doing the legal research, my offhand response would be we probably would not have the authority to mandate this on the federal programs.
Okay.
So.
All right. Thank you very much, sir.
Thank you, Senator.
Thank you, Senator Fisher. Just FYI, a request for a legal review of this bill was sent on Tuesday, March 7th, and received on Tuesday, March 28, 2023. According to Legal Bureau, the bill remains subject to review as to form and style. On the fiscal impact note, according to the Bureau of Budget Management and Research, based on the foregoing, there will be likely a cost impact to GBWIC, personnel, building, rental, supplies, etc. However, the overall impact cannot be determined at this time absent additional information from the center. And again, as referencing what was brought up here on the record, I'd just like to read into the record that, yes, the U.S. Food and Drug Administration on March 29, 2023, approved Narcan for OTC, over-the-counter use. Today's action paves the way for the life-saving medication to reverse an opioid overdose to be sold directly to consumers in places like drugstores, convenience stores, grocery stores, and gas stations, as well as online. And just to note, Hawaii has capabilities where you can order Narcan from a website and have it delivered to your address. Are there any further questions from the members? No? Okay. Anything else from the panel? Okay, thank you. There being no additional individuals to present further testimony, this committee will consider bill number 73-37 LS duly heard. The committee will remain open for the submission of additional written testimony for the next 5 working days following this hearing. For any additional testimony, that would be on Monday, April 10th, 2023. Testimony can be sent via email to Senator Terlaje, Guam @gmail.com, or be hand-delivered to the office, here, the Speaker's office at the Guam Congress Building. This public hearing is now adjourned. The time is 10:17 Chamorro Standard Time. Buenas and Afide. The Committee on Health, Land, Justice, and Culture is now called to order. Today is Monday, April 3rd, 2023. The time is 10:20 Chamorro Standard Time. In compliance with the open government law, notices for this public hearing were published in the Guam Daily Post and on the Government of Guam public notice portal on Monday, March 27, 2023 for a 5-day notice, and Friday, March 31st, 2023 for the 48-hour notice. This hearing is being live streamed on the Guam Legislature's YouTube channel. Notices were also disseminated via email to all senators and all main media broadcasting outlets on Monday, March 27, 2023, again for the 5-day notice, and Friday, March 31st, 2023 for the 48-hour notice. General rules of conduct. Individuals testifying shall first be recognized by the chair before speaking and begin by stating their name for record-keeping purposes. Agenda items will be heard today are the following. Bill number 49-37 COR, introduced by Senator Thomas J. Fisher, an act to add a new subsection 67.401.1A3 and amend subsection 67.407, both of Chapter 67, Title 9 GCA. Bill 49-37 Core was introduced on February 16, 2023, and referred to the Committee on Health, Land, Justice, and Culture by the Legislature's Committee on Rules on February 21st, 2023. I'd like to thank my colleagues for attending this morning's hearing, to include, of course, Senator Chris Duenas, Senator Jesse Lujan, Senator Telo Taitague, and on the individuals again present to provide testimony. Thank you so much. Before you hear from those who have signed up to provide testimony on the bill, I would like to invite the bill's prime sponsor, Senator Thomas J. Fisher, to please introduce the measure. Senator Fisher.
Yes, thank you very much, Mr. Chair. This bill, if we boil it down to its substance, this bill is designed to put us many steps ahead in the war on fentanyl. It's been said before in this hall, and it will be said again, that fentanyl is here, and it is coming, and it is a potential wave of catastrophe that will hit Guam and will kill our children, and we need to stop it, and it has to, and we have to win this war. You've heard me say this before, that we lost the war against crystal methamphetamine. We're having to start that one all over again. And we're not going to lose the war against fentanyl. In an earlier hearing, I mentioned a New Yorker magazine article that speaking about the county of Hays, Texas, where fentanyl has exploded in the high schools and the junior highs, and are overwhelming the county with the number of deaths of their children because of fentanyl. Fentanyl is an extraordinarily dangerous drug. It is a drug that is cheaper to manufacture than street Xanax or street Percocet or what have you. It's actually cheaper, and it can be molded into very different shapes, some to look like Skittles, some to look like vitamins, some to look like Flintstones vitamins, and these things are attractive to children. As adults, I don't think that we have much choice other than to do. We don't have any choice. We have to save the next generation and the generation coming. And this is just one step in doing it. And I'll tell you, quite frankly, when I wrote this bill, it was not an easy bill to write, because if you negligently, it's an accident, sorry, it was an accident, you negligently distribute fentanyl to an infant, I'll use that word as we do in the law, an infant, somebody under the age of 18, if we negligently distribute to an infant, you're going to get 20 years in jail. If you negligently distribute to an infant and that child suffers a serious injury or that child dies, you're going to go to jail for life. That wasn't an easy decision to make, especially when you tie it to negligence. I think that all of us could understand if you were doing it intentionally, bringing such a hammer down on you. But do we really have a choice in this? Is this the time to, I guess, weigh the positives and the negatives on this? Even if you've done it negligently, sir, you brought that drug into the house, you brought that drug into the orbit of the infant, and you are responsible for it. And I really appreciate the Attorney General's being here. I know that, and as well as the public defenders, I know that you appreciate the concern with which we have approached this issue. And I am very interested in hearing, because we have 3 lawyers here, I'm very interested in hearing commentary on the bill, ways that it can be improved, whether or not the punishment that we have incorporated, 20 years or life in prison, whether or not you think that is equitable. So with that, if we could turn it over to the panel.
Thank you. For the record, in addition to stakeholders' invitations to provide feedback and testimony were sent to the following: the Office of the Attorney General, the Judiciary of Guam, Director of Policy, Planning and Community Relations at Public Defender Service Corporation, the Guam Bar Association, the Guam Medical Association, and the Laddie Treatment Center. We'll now accept testimony from those on the panel, beginning with from the Office of the Attorney General, Heather Zona. Good morning, ma'am.
Good morning, Senators. And again, it's Heather Zona. Is this lower?
You could,
Sorry.
thank you
Okay,
so much.
There we go. Thank you. So, good morning, Senators, and thank you for letting us be here today. I am Heather Zona. I'm the Acting Chief Prosecutor for the Attorney General's Office. So, thank you for allowing me this opportunity to speak with you today about Bill 4937, and that bill proposes changes to the criminal code regarding controlled substances. And we know that code section is the Guam Uniform Controlled Substances Act. So I applaud the legislature for taking a proactive approach to the serious issue of adults providing narcotics to children. We're all aware of the devastating impact illegal drugs have had on our island. Victims are being physically abused by people high on meth. Meth addicts are stealing property to fuel their habits. And in some villages, people are living amidst drug-related violence, shootings, and the like. And through all of this, we have to think about the impact on our young people, and we have to do our best so that they're not victimized by the illegal drug trade. And as the Chief Law Enforcement Officer for Guam, the Attorney General, aggressively prosecutes crimes involving drugs, and will continue to do so. We work with our partners in law enforcement, such as the police, customs, and the DEA. But obviously today, our focus is on those who provide illegal narcotics to children. So let me be clear. People who harm our children deserve the harshest penalties. So the bill that we're talking about today, it proposes criminalizing the provision of certain controlled substances listed in the statute to minors on Schedules 1, Schedules 2. And it's proposing that people who negligently, recklessly, knowingly, or intentionally distribute a narcotic drug listed in Schedule 1 or 2 under the statute will serve 20 years in prison or life in prison if a death or serious bodily injury occurs as a result of that narcotic. Now, the impetus for the changes proposed today are the very tragic circumstances in which children have been exposed to fentanyl. Fentanyl is a synthetic opioid that is up to 50 times stronger than heroin and 100 times stronger than morphine. It is a major contributor to fatal and non-fatal overdoses in the United States, stateside. But there are 2 types of fentanyl. There's pharmaceutical fentanyl, and then there's also illicitly manufactured fentanyl. Both are considered synthetic opioids. Pharmaceutical fentanyl is prescribed by doctors to treat severe pain, especially after surgery and for advanced stage cancer. But according to the Centers for Disease Control, the most recent cases of fentanyl-related overdose are linked to illicitly manufactured fentanyl, which is distributed through illegal drug markets for its heroin-like effect. It is often added to other drugs because of its extreme potency, which makes drugs cheaper, more powerful, more addictive, and more dangerous. Powdered fentanyl looks just like many other drugs. It is commonly mixed with those drugs like heroin, cocaine, and methamphetamine, and it's made into pills that are made to resemble other prescription opioids. Fentanyl-laced drugs are extremely dangerous, and many people may actually be unaware that their illegal drugs are laced with fentanyl. Make no mistake, fentanyl is a very dangerous drug, and we've been fortunate not to see so much fentanyl on Guam with the same frequency that they've seen it stateside, but it would be naive to believe that this status will not change. Law enforcement already has seized shipments of various drugs, including fentanyl, which otherwise would be on the streets in our villages. But turning back to the statute that we're discussing today, there are actually many narcotics that are listed that would be implicated by these proposed changes. So considering the proposed legislation requires that we view different situations where other drugs would be impacted as well. So the scenarios we consider when we think about children being exposed to drugs are those that are reported here. Parents are abusing illegal drugs. They keep their drugs, they keep their drug paraphernalia on the coffee table or somewhere accessible to children. A child, a toddler, a teenager, maybe a friend of those individuals comes to the house, finds the drugs, takes it, and dies. As law enforcement, this is an easy call for us. Sitting here today, the parents would be prosecuted for homicide, for child abuse. We have the laws right now to address that situation. And similarly, where an adult gives a minor illegal drugs, we can all agree who should be prosecuted. Not a question. But there are other scenarios where it is not so clear, and I would encourage the legislature to consider the unintended consequences of this proposed law, because it may actually make it difficult for us to prosecute cases, and this would undermine the effectiveness of the law. So we can think of the grandfather, for example, who is in bed suffering from stage 4 cancer. He has morphine or some other high-powered opioid to treat his pain. If he asks his minor grandson to get him the bottle so he can take the medication, do we then prosecute the grandfather for delivering narcotics to the grandson? Or do we prosecute the parents for allowing their son to handle the grandfather's medication? Because clearly this is an intentional act for the grandfather to ask the grandson to hand him his medication. And under the law, that would be illegal right now. So, as drafted. But we can imagine another scenario where someone has oxycodone in the home for a medical condition. It's in the medicine cabinet. And then that person goes off island and has someone come in to house sit. The house sitter's teenagers find the oxycodone, even though the house sitter had no idea it was there. And even though the owner may not have known that there were going to be teenagers, folks underage, in the home, or that they would rifle through the medicine cabinet. So who do we prosecute? Do we prosecute the house sitter for negligently not checking the house, making sure that it's safe and free from these medications? Do we prosecute the homeowner who has oxycodone in their own medicine cabinet for their own medical condition? I mean, who is criminally negligent here? It's not clear. So there are many scenarios like this, and while the proposed changes to the law are well-intentioned, they will make our job as law enforcement harder because it can be unclear who should be arrested, who should be prosecuted. And that's not only our difficulty, that's a difficulty that the police would have when they go to report to handle a situation like this. Now, some of the issues surrounding the provision of drugs to minors are addressed through Section 3130 of Title IX. Those provisions regard child abuse, and it's fairly clear there. So the legislature could amend that section's penalties for child abuse where the incident involves providing drugs to minors. And this would include all illegal drugs, including marijuana, which is still illegal under federal law. We do not believe anybody should be providing illegal drugs to minors. Similarly, our homicide laws already provide for life sentences, but the legislature could amend the penalties where a minor's death is due to an adult providing a minor with illegal drugs. So for the foregoing reasons, I would encourage the legislature to consider amending the proposed legislation to make clear that the law is designed to protect children by criminalizing the intentional or reckless provision of illegal drugs to them. Because, again, we are not just talking about fentanyl. We are talking about a whole host of other drugs that are listed on those schedules, and it has very wide-ranging implications. So thank you for this opportunity to provide testimony on this important issue. Our office remains dedicated to being Guam's toughest law enforcers, and we would like to be able to do that with the laws as they're written. Thank you.
Thank you. Quite a lot of concerns there. John Morrison, Public Defender Service Corporation.
Thank you, Senators and Senators. My name is John Morrison. I'm the Deputy Director of the Public Defender Service Corporation. It's nice to see everyone. I've testified before this body many times, and it's good to be back. I wanted to start by commending the bill sponsor and the 37th Guam Legislature for its commitment to children and children's issues. It's been apparent in the legislation that's been drafted recently and in the discussions that have been had. I have reviewed the law, and I am opposed to it, though, for many of the same reasons that Chief Zona just described. I think if we look at the law, the legislative intent section, just by background, says that fentanyl is manufactured for the illicit drug market for those seeking a more powerful high. And that may be true to an extent, but I don't think that necessarily explains the full picture of what's going on with fentanyl in the U.S. and internationally. I think this is a drug that is prescribed during end-of-life care and for those in severe pain. But there's also the issue of people getting fentanyl from overseas labs and that sort of illicit activity. There was recently, back in September, a continuing legal education conference that the District Court and Pacific Judicial Council put on, and the highlight of that conference, in my view, was that there was an attorney from the U.S. Department of Justice Cybercrimes Unit who, in real time, went onto the so-called dark web, projected it into the back of the room, and showed us all as he was able to shop for illicit drugs online, and explained exactly how the process worked. It seemed very easy. It was essentially like looking at Amazon. The hardest part of the whole production was downloading the software so you could access that part of the internet, essentially. So there's obviously a fear, I think, in the U.S. and internationally that people are getting fentanyl from illicit places through the dark web. So this doesn't solve the problem as far as I'm concerned. It sort of makes it more nuanced. As far as I can tell, if it were one extreme, the law was designed specifically to prosecute El Chapo or someone, then I think we would all be in agreement that that's a legitimate concern and that you should go after him with both barrels. The concern here, I think, with the dark web is that the minor receiving the drugs might not be getting it from El Chapo, they might be getting it from one of their peers. So a 17-year-old might be getting it from their 18-year-old boyfriend or something like that. So I think we need to think carefully about whether or not that's an outcome that you truly want to see. If this person who thought they were getting Adderall received it from a lab overseas that is unscrupulous, and it turned out when they gave it to their 17-year-old girlfriend who asked for it, that there was a bad reaction and authorities had to be called. I think we need to think carefully about whether or not we want to put that 18-year-old in a position where they're getting life in prison, because there are already a number of laws currently on the book that I think are more than adequate in their punishment. So there's various concerns that I have. One is that a youthful peer would have been the person that gave the drug to the victim in this case. The second, I think Chief Zona discussed in some detail, and that's someone that's going through end-of-life care, may have it in their medicine cabinet or something like that, and their little grandson comes in and thinks it's a Flintstone vitamin, or it got mislabeled in the medicine cabinet in the wrong jar, and tragedy ensued. I think we need to be very cautious about prosecuting that person to the extent this law would allow. I said previously that I think the current law is very thorough, and Chapter 67 is as lengthy and as comprehensive a law as I think we have chapter as we have on Guam. Currently, the penalty for anyone who distributes a Schedule 1 or 2 controlled substance to another person, anyone, is going to face a first-degree felony, and they're going to face a penalty of 5 to 20 years in prison. In addition, there's the 5-year enhancement if they give it to someone who's under 18, and this is in addition to any laws that are broken if, for instance, the victim has a bad reaction. If there's a homicide, if there's an assault, then those laws are going to be activated. Additionally, if there is an assault, the Attorney General could prosecute the person potentially for possessing a dangerous weapon, the drugs itself, which would expose them to another enhancement of 5 to 25 years in prison. So, you know, everyone only has one life to live, but I think if we stacked up those numbers, we're probably pretty well into a normal lifespan with the types of laws that we already have currently on the books. We're very concerned about the negligence standard. The negligence standard is incredibly low. It's essentially as though someone made a mistake or an error, but it was an error that they, in retrospect, should have been foreseeable. The standard is incredibly low, and I think, as Chief Zona put it, it's going to potentially create situations where the grandparents who possess the fentanyl could be charged with negligently distributing it, and people that didn't know they had fentanyl at all, who received it from someone who received it from a lab somewhere, would be faced with these negligent type of mental state. You know, I was struck just finally on that issue. I did look up the law, or I don't want to say case, but the situation here where the infant son of the San Francisco tech boss overdosed, and that was referenced in the legislative intent. And I was struck by something that the father said in that article after his son was administered Narcan and survived, and this legislature has passed a similar law that would allow for the same result just recently. But the father said afterwards, quote, I just wanted to let people know that along with coyotes and RSV and COVID, this is another thing we need to add to your checklist of things that you're looking out for as a parent, because we weren't. So the concern here, just as a final thought, is that that father now knows that when he takes his son to a park in San Francisco, he's on notice that there may be fentanyl present. So if there's a negligence standard, if this happened to that father again, it seemed like, to me at least, that he could be prosecuted based on that incredibly low standard of taking his son to somewhere where he knows the parents should be looking out for fentanyl. Now that's a tragic result, but I think the legislature needs to be cautious on lowering the legal standard of culpability to negligence or recklessness, when I think it's really the evil in somebody's thoughts and actions here that need to be prosecuted, not negligent or reckless behavior. Those are my comments. Thank you all very much.
Thank you, sir. Attorney General Doug Moylan.
Good morning again, Senators. I agree with and I amplify the Chief Prosecutor's comments. And with Senator Fisher being an experienced criminal litigator and prosecutor in his past history, I respect that this bill is attempting to further punish with the crimes associated with conduct that's hurting our most vulnerable children. I put myself, when I read this, in the place of a juror. And the worry that I have, that having seen jurors, they go both ways, right? And that the grandfather, which everybody has, seeing that their child or their grandchild is doing something that you can't really control, part of society these days, and then him having to be punished. I'm just a bit worried on that, and I'm sure Senator Fisher is also concerned about that negligence reckless standard that's being talked here. I think that we might end up in the Supreme Court on issues about the appeal of that case, and I'm of the opinion usually try to stay away from the potential appellate problems that might occur with it. I do agree with the chief prosecutor commenting that maybe we should beef up the child abuse statute, direct a lot of these things right into that child abuse statute and make it a special enhancement that if it's found that there was a knowing and intentional type of behavior that resulted in the child suffering, that's where we can enhance it. Same effect, but in a different area of the code, because there are many statutes out there, and when we go through the indictment process, you know, the ham sandwich type argument, we can throw a lot of things in the indictment document, but getting it to stick before a jury, such as yourselves, just sitting there and listening to it, I think is a good standard to review this legislation as it filters its way to the final legislation. Thank you.
Thank you, Attorney General. Ms. Patricia Moffness, Public Health.
Hi, good morning. So I'm Patricia Moffness. I'm the Acting Chief for the Division of Children's Wellness at the Department of Public Health and Social Services. So the Guam Department of Public Health and Social Services, Division of Children's Wellness, Bureau of Social Services Administration, supports this bill and its efforts to protect our island children. Child Protective Services receives referrals that involves children at risk due to drug use by caretakers. In FY22, CPS referrals involving drug use were 14%. In the first 6 months of FY23, CPS referrals are already at 15%, and we anticipate a higher percentage for the remainder of the year. CPS shall investigate in accordance with the Child Protective Act of Guam and respond to reports that a child has been harmed or is subject to threatened harm. Any case where a child is provided with a controlled substance is defined by the Criminal and Correctional Code is considered child abuse. To protect our youth, I exhort this esteemed body to pass the bill. Thank you.
Thank you, ma'am. I guess we'll go ahead and start with Senator Duenas.
Mr. Chairman. This legislature today is, has the feeling of being in the courtroom, which is appropriate, given our chief legal officer and probably one of the chief defense counsels, or at least one of many. But I want to say my takeaway is, and thank you to Public Health, is that what we all care about more than anything else is our children. And the effects of the current modern day opioids and the complete unacceptable rate of distribution in our community that is an absolute plague. I just don't think there's any other way to say it. And unfortunately, what's happening in our nation, the 50 contiguous states and other areas, is filtering out to our shores. And I like the testimony earlier saying it would be naive to think, Ms. Zona, I think you just hit the nail on the head. It would be naive to think that ravage has an attempt to do great harm to our community. So I've listened carefully, and I think there's been some wonderful comments in terms of potential to mark the bill up, much like the earlier bill. There are things. I know the author, much like myself and others, and every esteemed member that's been here to testify on this bill, know that we need to do something outside of the corners of the law that were explained, that we have a great deal of ability to enforce current statute. I don't know what it's going to look like, but a message needs to be sent. And I applaud the Attorney General's office for exuding that message since day one of being in office, that when it comes to law enforcement and when it comes to protecting our children, it's job one. So I know that the author and my good colleague is an esteemed jurist, and he'll take whatever's been presented to try to, narrow the scope of what the intent of this bill is. But I hope that regardless, this bill or whatever vehicle goes forward from this esteemed legislature makes it clear, as public health is put on the record here, their only concern is the children. So with that, Mr. Chairman, I'll listen to the balance of questions and answers, but I know where the heart is and the soul is and the belief is from the author, and so I'm hoping that we end up with a product that reflects that. Situs Masi.
Thank you, Senator Duenas. Senator Jesse Lujan.
Yeah, thank you very much, Mr. Chair. You know, there's no doubt with even the testimonies given that we're all on the same page in regards to the children and trying to get in front of this whole fentanyl situation here. We also know that, of course, fentanyl has a medicinal use in being used legally. As the author had said, and the defense attorney was talking about, of course, the situation where illegal drugs and disguised, I guess, as fentanyl are out there, and those are what's pretty much running rampant back in the United States. And, you know, again, for the author, this is the author's version, this is the legislature's version in the state of the emergency that we're in. And I'm just hoping at this point, and again, that we are, that the governor would proclaim not only fentanyl, but because it will be coming, but that we are in a state of emergency in regards to into the crystal meth situation here on our island. And so that being said, I look forward to, again, as the testimony is being brought out in regards to the unintended consequences that, again, things that are written here in regards to, say, maybe grandfathers and having a grandson or grandchild giving them their medication and who's responsible for that. So I look forward to the crafting of the bill, again, to address those unintended consequences. But again, as the author, this is the author's version of a state of emergency here in our island. And I hope that the governor is listening right now, because this is one war that we don't want to also lose again. And so that being said, I commend the author, and I look forward to working with him and my colleagues again to address the concerns brought by, again, most of the legal committee here in Guam. But thank you very much.
Thank you, Senator Lujan. Just a couple notes. Fiscal impact note: according to BBMR, Bill 49-37, CORE is granted a fiscal waiver pursuant to Public Law 12-229, based on comments from the Office of the Attorney General that the bill does not ascertain an immediate fiscal impact upon the reviews of the expenditures of any funds of the government of Guam. With that, I'd like to turn it over to the bill's author and prime sponsor, Senator Fisher. Go ahead.
Thank you very much. I hope I didn't leave you all with a false impression. This bill is draconian, and it is draconian by intent. This bill is not a negotiation with those who kill our children at all. This bill intends to put people who negligently, recklessly, intentionally allow contact of fentanyl, and perhaps, as Ms. Zona referred, other medicaments, other illicit drugs, you're going to pay a consequence for it. And as I said in my opening statement, it wasn't without thought that this punishment was imported. As one of my colleagues observed, the war on methamphetamine we lost. And we're not going to lose the war on fentanyl. This bill is designed to protect children, infants 18 and below. It is also a mirror of the other subsections. There's nothing surprising in the bill except for perhaps the use of the word negligence. And I totally agree with the Attorney General's office that the use of the term negligence here is really gives an attorney pause. I've prosecuted many cases, of course, and I'm sure you have as well, and, you know, proving intent, a negligence statute, easy to prove. It's much more difficult when you come against something like intent. A scenario where a grandfather asks the grandson to bring them morphine. Perhaps the child is in possession. Perhaps you could make a constructive argument that the child is in possession of morphine. Perhaps. But it also occurs to me, and I've made this decision, and all of you have who've prosecuted, many times we've had to use our discretion to determine which cases we're going to prosecute and which cases we're not going to prosecute, and that decision is never easy because you're constantly doing that internal balancing. Am I being fair to the defendant? Am I being fair to the other defendants who I may or may not have prosecuted under similar circumstances? And I would just say, and I'm sure you'll join me in this, it is not an easy task. It's one of the most difficult tasks a prosecutor has. But a prosecutor nevertheless has undertaken the responsibility to make that decision. Because we all know, and I hope the people listening understand, that prosecutors know deeply that merely the allegation by the government that you have done a criminal wrong will upend a life. It will turn it absolutely upside down until it is resolved, and even after that. The job of being a prosecutor is one of immense responsibility, and I respect that. Career prosecutors are undertaking something many of us wouldn't, but I just want to clarify that this bill is designed to be a hammer. A hammer. It is not, and it is substantively no different from the other provisions of the law. And I deeply respect, and I just said this, I deeply respect a feeling of reluctance to incorporate the negligence standard because, you know, it was an accident. Yeah, we understand that. Your accident had a consequence and that child is dead because of your accident. So, having said that, I want to make sure that there is a buy-in on this bill from the Office of the Attorney General, because you would have to work with it. And just to create this law and throw it in your laps without hearing from you, as we have this morning, I think would be I think we would be laying down our responsibilities not to listen to a key stakeholder. So I think it was Senator Lujan used the idea of a markup. I welcome that enthusiastically. I would love to hear a way to improve the bill. And it's going to require a lot of thought about this negligence standard. As I told you, this was not an easy bill at all to draft. Well, for that reason. And then, well, I was going to ask, Mr. Morrison, this question's rhetorical. I hope it don't sound like I'm a smart mouth, but do you think the current laws as to methamphetamine have helped us to win the war?
Senator, thank you for the rhetorical question. I'm hard-pressed to think of any jurisdiction that has been able to legislate their way to a successful victory on the war on drugs. I don't think anything we have currently has resulted in that in any jurisdiction. I don't think this law will result in that.
Do you think we ought not to legislate? Just give up?
Well, I suppose the legislature could keep a careful eye on what's happening in Portugal. I know there was a recent white paper that came out in the last few years, but it's not anything as radical as I would propose today. I think there probably are things that could ensure some level of safety, particularly the allowance of drug testing without consequence if we're truly worried about fentanyl finding itself into what somebody has in their pocket.
But we're really worried about fentanyl making its way to an unsuspecting infant.
Well, I'm not sure that that's the bulk of the overdose cases that they're seeing. It's clearly one that the Senator has highlighted. And that seems to have been a situation where drug-abusing parents either knew or should have known that they had fentanyl. They may have thought they just had heroin. But those people are currently facing murder and child abuse charges, as they should be. And that seems as though that's going to result in a penalty in all likelihood that's commensurate with the actions.
Okay. But you do understand that this bill is also designed at getting to those situations where it's negligent. Whereas murder, for example, is generally, there's negligent homicide, but murder requires a higher level of intent.
Yes, I'm quite aware, and it seemed like the lowering the standard to potentially catch a lot of people in the net that we weren't truly after was my concern with lowering the negligence standard.
Okay, thank you, and thank you to all of you for testifying. Thank you very much.
Mr. Chairman, I have one more question.
Senator Duenas.
Ms. Zona, along the lines of the questioning from Senator Fisher and the exchange with Mr. Morrison, do you believe the discretion that the Attorney General's office has would be an important tool? Because I know that if you've got to charge out, you know, you're going to have that, take that in consideration. But I'm telling you right now, I would imagine a junkie on the street who's involved in peddling something that kills a kid. I would imagine your discretion would be pretty easy on that. And that the negligence portion, there would be some due consideration. I just wanted, it's burning in me, so I had to ask that. Thank you, Mr. Chairman.
So thank you, Senator. I do have a lot of concerns about tossing in a lower standard because I think that, number one, it opens up the law to challenges, to constitutional challenges. I'm concerned about, we always have discretion. Discretion as a prosecutor is absolutely one of the most powerful but important tools that we have, because as prosecutors, our job is to further justice. It's not to win a case. It's not to lock up as many people as we can or let go of as many people as we can. It's always a question. That's why we have so much discretion, because ours is a job that looks at what's the justice of the situation. I'm concerned about adding something like negligence because I think that it confuses the legal standards of civil litigation and criminal litigation. And it opens up the law to challenges on a constitutional basis or some other basis. And I would hate for a message that is getting out in terms of liability and in terms of the importance of the issue to be sidetracked by those kinds of things, because I think that those create distractions, and it keeps us from being able to actually pursue the cases. Right now, as we sit here, you know, we're talking about fentanyl, but again, we have to remember that this legislation applies to all drugs. So we already have parents who are passing drugs along to their kids in the way of a newborn baby that's born positive for any number of drugs. And those kids are taken away. They are handled in a separate proceeding. That parent, you know, has to prove that she is able to take care of those kids. So it's already happening with other drugs. We already know that in houses where methamphetamine or any other drugs are abused on a regular basis, we know that those children in those homes are likely to grow up abusing drugs themselves, because the abuse of drugs is treated as a normal event. Much the same way that, you know, in my house, we always had dinner at a certain time. That was our normal event. But for these situations with these families, it's tragic. So they're growing up with that. So while I do think that discretion is very important, I am concerned about shifting burdens because it will make our job prosecuting much more difficult. And even though we always have the discretion, you know, are we treating one class of people differently than another? We're going to open ourselves up to those challenges as well. Those are, you know, those are just constitutional challenges. So that's why I would encourage looking at some of the other areas to stiffen up the penalties, because I think that if you want to send a message about not abusing our children, because this is what we're talking about. We're talking about child abuse here, and we're talking about homicide. Then I would look in those areas. You know, in theory, I completely support, you know, protecting our children, because it's not just fentanyl. It's all these drugs. It's alcohol as well. I mean, if we think about it, you know, people are buying alcohol for underage kids. That's a crime already. You know, we should be looking at that as well, because it's very possible that children in that circumstance could end up passing away from alcohol overdose. But that's not going to be dealt with through this crime. That's why I'm encouraging, you know, really a closer look at something like the child abuse statute, because then I think that if you're looking to protect children and to really bring it home that there are serious consequences if you want to have your drugs laying around your house, if you're not going to take the time to make sure your children are safe, then there should be consequences for that. And that would capture a lot of scenarios that go beyond the drugs. It deals with alcohol, it could be any other, guns, who knows? I mean, the sky is kind of the limit when you think about it, because as you folks pointed out, you know, teenagers experiment. Kids make poor choices. That's why we're here, is to guide them so that they make good choices. So on that, that's why I would really encourage examining the child abuse statute to really beef that up. I think that might be a better solution. So.
Just one quick comment to that, you know, also in school zones, I mean, these bad guys are using kids as mules.
That's right.
You know, there's that much, there's that amount of craziness. You know, we have restrictions in terms of churches and school zones and laws of what can happen and what can't happen there, but yet these evildoers really will use children for a couple different reasons. One is their, you know, their ability to avoid harsh prosecution, and the other is just the lure. So I think we're on the same page, but man, we got to do something. Thanks.
And that is correct, Senator. I know that, you know, I've worked for many years with kids in foster care, and the number of children that had been introduced to drugs by their parents was staggering and devastating, really devastating, to think that any child would grow up in that kind of environment. Children that were trafficked by their parents, children that were used by their parents as mules, as you're saying. So it's a huge problem when we're talking about protecting the most vulnerable, our children. But, you know, again, I think that if we want to do that, I would focus more on the child abuse statute, because I think that we're going to be able to include a lot more that we need to include, quite honestly. So, thank you.
Thank you, Senator Duenas. Is there any further testimony? Comments? Thank you. Your many concerns are duly noted. And I'd like to turn it over to Senator Fisher for his closing. Senator Fisher.
Thank you, Mr. Chair, and thank all of you for your testimony. Really appreciate it. And I gather from the testimony that the Office of the Attorney General is willing to help, perhaps in a markup of the bill, to meet some of your concerns. I appreciate, again, you know, this has been said so many times, I guess, but I appreciate the difficulty of creating a criminal statute with negligence as its intent. It's very difficult. It's very rare. It's a very rare thing. That being said, I think often about that New Yorker article I referenced earlier, and the idea in a middle school or a high school of a stretcher making its way down the hallway with a child dying from a fentanyl overdose. And I hope that's one of the reasons we get Narcan in every single classroom. But I think of that often, and it has to, we will not allow that to occur on Guam. We're not going to negotiate with these killers. There is no room to negotiate when it comes to children's health, because that's one of our responsibilities. We're adults. We've only got a limited time left here on Earth, and those kids that are in the schools right now are going to be taking over, and we have a responsibility to protect them, and they have a responsibility to protect the next generation. So when we feel or when we see that embrace that we hope to give our children slipping away because of a poison, there's no room for negotiation. I totally agree with the Attorney General's observation that there are so many problems, alcohol, nicotine, vaping, everything, that are affecting and destroying our children. And we are going to do what we can. We're going to take them down one by one. And this is a step to protecting those kids. This is a step towards fulfilling our contract, legal and moral, with the next generation. And I very much respect all of your opinions, and thank you for them. I particularly, Mr. Morrison, thank you, because you have illustrated another side, the other side of the coin, which is, wow, this is a lot of punishment for what is perhaps the worst mistake you'll ever make. And Child Protective Service, I appreciate what you do, and I thank you for the support on the bill. And to the Attorney General's office, I look forward very much to working with you on this bill and fighting, linking arms, and fighting this together. The responsibility is every bit as much yours as it is mine and my colleagues here on the bench. Thank you again, and I look forward to this fight because we're going to win it. So we're going to win. Thank you very much. Thank you, sir.
Thank you, Senator Fisher. There being no additional individuals to present further testimony, this committee will consider Bill number 49-37 COR duly heard. The committee will remain open for the submission of additional written testimony for the next 5 working days. Following this hearing, that would be Monday, April 10, 2023. Additional testimony could again be sent via email to Senator Terlaje, guam@gmail.com, or hand-delivered to the Speaker's office right here at the Guam Congress Hall, Guam Congress Building. This public hearing is now adjourned. The time is 11:13 Chamorro Standard Time. Hasta Dios.